Hi, everybody. It's Patricia Coughlin, and I wanted to talk to you today about the dangers associated with diagnostic labels. Now, a lot of us as mental health practitioners get encouraged to come up with these labels for insurance and things like that. And you may not be aware of the dangers associated with conflating the human being sitting in front of you with their problems or with their defenses. So, very often I'll hear clinicians refer to a patient as a borderline or as schizoid. And so they are identifying the person by their problem. And this research shows, and there's an interesting meta analysis on the negative impact of labels by Rebecca Sims and her colleagues. And it turns out that this has an adverse effect both on the patient who's receiving the label. They actually have an increase in psychological distress and a decrease in functioning, also a greater willingness to participate in more and more invasive kinds of treatments. And so it really has a negative effect on patients, but it also has a very negative impact on clinicians. So there was an interesting study where they had clinicians look at a written up case and I guess predict, how the treatment would go or, their response to this person and whether they'd want to treat them or not. And in one case, they simply gave them a label. This is a borderline. Whereas in in the other category of the study, they simply described the person. This is a 32-year-old single woman who struggles with affect regulation, a tendency to indulge in purging, but just describing the person with a problem. And the clinicians responded much more positively to the description than to the label and had a better prognosis. And so this is important because we have our own negative expectations around these labels and biases, which really affect not only how we're viewing the person, but also the likelihood that they will be able to benefit from treatment. So I really want to encourage you to be mindful of this and not to fall prey, to these kinds of reductionistic labels which again have all of these negative consequences. I just finished a follow-up, a 1-year follow-up on a patient who came to me when she was in a very dark place and very stuck. And she's had really a spectacular outcome. And so I wanted to follow up on that, but also ask her about the factors that she thought were responsible. And I really encourage you to do this with all your patients. It's very illuminating. And in addition to very specific factors, she spoke to something that I hear a lot, which is that she experienced me as very encouraging. And while we took on the problems and difficulties in an unsparing manner, I didn't simply focus on the problems, but on her potential and on her capacity to deal with these in a healthy and creative manner. And so, again, if you've labeled somebody as borderline or schizoid or whatever, you're not going to be very encouraging. Right? So, and this is incredibly important, and it's something, again, that Dav and Lou certainly taught us, which is always to operate at the patient's highest level of capacity and not to be operating from, sort of that position of their lowest level of capacity. So I think this is just a really important reminder, and I hope it's helpful to you. Again, I'm very open to your feedback, so please let me know what you find helpful and what other topics you'd like to have covered. Thanks. Bye bye.